Hi, I'm Bill Doherty, and I want to welcome the viewers to another edition of Bill's Bullpen. Bill's Bullpen, of course, is a program that's intended to show what's going on in the region and bring up things that I think people might be interested in finding out more about. With me today are members of the Bourne Substance Abuse Coalition. Beth Griffith, you're the chair, right?
Yes, I am.
And my good friend Joe Carrara, Deputy Chief in Bourne.
Thanks for having us, Bill.
Oh, you're welcome, the EMT. To start off, I read a thing when I was preparing for this, and it was, "I will kidnap you, then return you to your family so they can bury you. Sincerely, drugs and alcohol." And I thought that based upon your title, that maybe we could talk a little bit about that. First of all, what is the Substance Coalition in Bourne?
I think the Bourne Substance Free Coalition, number one, it's been around for a lot of years. It began in 2010 with John Doble, who was, he works for the Bourne, a retired Bourne police investigator, and Sean Cahill, who worked for the Barnstable County. And we were actually having a conversation about all these struggles that kids and families were having with opioid addiction. And it was like, what are we going to do? And we really truly wanted to make a difference somehow. So what we began to do is do community presentations, and we did them at Upper Cape TAC. And what we wanted to do was educate and prevent substance use in our community. So Upper Cape was kind enough to let us do this panel, and we did that, and it was very well received with a lot of parents. And then in 2012, Donna Beers and myself worked to bring that information to young people. So we brought Chris Heron into our schools at Bourne High School. Then he went over to Upper Cape TAC, and then we did a community presentation. And it was extremely well received. He has a very powerful message of being an athlete, being a star athlete, and how you can lose your life to substance. And then in 2013, we had a Knockin training in the town of Bourne. And Upper Cape TAC, again, we held it there. And there were over 100 people in our town that attended that event, which only spoke to the amount of families that wanted to possibly save the lives of their children or loved ones.
Are you still getting what I'd call when you see the amount of people that are affected by substance abuse?
I still believe we do, but I think it's less because it's so prevalent. And we'll talk in a couple minutes about how prevalent it is in our own town. And Bourne is recognized within the state as one of the 16 communities that have one of the highest rates. And that's why we have monies available through Mass Healing Community Study. But Joe, in 2015, Joe reached out, and at that point we became a great working relationship, and we began the Bourne Substance Free Coalition, had a mission statement, created a great team of individuals. The individuals that are on the coalition are Lieutenant Brendan Esep from the Bourne Fire. Bourne Police, Deputy Fire Chief Joe Carrara, Maria Oliva from the Chamber of Commerce, David Sampson, the former superintendent from UCT, members of the Bourne Council Regional Substance Use Organization. Stevie from the Board of Health has just reached out and has offered her assistance in posting our information on the town's website. We have therapists, teachers, parents who have children who have struggled with substance use, parents who have lost their children to substance use, and people who just want to be a part of it. But I think the nice thing, and Joe, please feel free to add in, we've been able to incorporate kids into this as well. So we've had UCT students and Bourne High and Bourne Middle School kids actually volunteer in various projects that we do and we can talk about at a later time. But it's about spreading, it's about building a collaboration of people in our community to help address this issue.
One of the issues that has always troubled me was that when I was taking social psychology courses in graduate school, where they talked about developing the right or understanding the right to passage. That's what kids would try different things because it was part of the maturation process that they were going through, regardless of how harmful it was. One of the points that was made, and this was, back in the 70s, anyway, it was a long time ago, that they talked about that they had done efforts to, to advertise the affect of different substances, and one of the outcomes was that the usage in that particular survey population went up because the kids found out it wasn't as dire as not having anything to do with it at all. So the question I have for you is that what have you found out as far as prevention means? And I think this is something that concerns all the people in the community. What is the most effective way of presenting a prevention strategy?
From my perspective, I work with kids, and for the past 24 years at Upper Cape Tech as a school counselor and a school adjustment counselor, and I think education is very, very, very important. And I think the earlier that you can educate kids about substance and the effects of substance, but also even the larger part of pharmaceutical companies, tobacco companies. One of the things that I think is very interesting or very informational to kids that kind of the light goes off is this was a generation where we had kind of gotten over kids smoking cigarettes. So you look at what the tobacco companies did, they created a vape pen.
Let's see, what was it? Not a cough and a carload. I remember that. And they had doctors or actors dressed up as doctors with white coats on, and then they had this business of the Marlboro Man.
Exactly.
And all of this very macho and very this is where you wanted to be. You wanted to be part of this. And smoking makes you look cool, and I have to say that when my wife, after a lifetime of smoking, died of lung disease that was associated with it, that I was always concerned with it, and she had given up smoking because of pressure from the grandchildren a couple of years before, but it still was a residual effect. So it wasn't like stopping and the ashtray will clean out. It does stay with you. So better not to start.
Exactly. So I think the earlier that you can give kids the information and let them to see how companies can manipulate you to, okay, well that's great, smoking's bad. So we've got now this Juul pen and it isn't harmful and blah, 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 blah. And people were actually, it was on advertisements that women were using it to get off of cigarettes. Well, we don't see those commercials anymore. So I think the new thing is to work with kids around vape pens. And again, it's addiction.
Okay, well, let's talk a little bit about the fact that addiction is a disease.
Correct.
Okay, and I think a lot of people don't appreciate the fact that it is a disease, and addiction has several different parts. You're addressing two of the parts, alcohol and drugs. But addiction deals with overeating, it deals with hoarding, it deals with a lot of
gambling.
Other things that that everybody gets involved with. And in my opinion, I think that a lot more of us have to appreciate that fact so that when we approach it, we just don't approach it. He could give it up anytime he wants.
Exactly.
Okay. The point is that the addictive behavior is very invasive.
Exactly. I think the genealogical makeup too, is that piece of visiting your family and what are your chances are when I'm working with kids if mom and dad have struggled with substance or addiction, as you say. So if somebody struggled with gambling, somebody struggled with food, somebody struggled, but in the key being that it interfered with their daily living, okay, your chances of having a problem in some area is higher than the family that doesn't. And so that, again, that educational piece or bringing them an awareness to, you could be playing with fire.
Exactly.
And one of the things our committee stresses is positive life choices.
Yeah, absolutely.
And you brought up a good point. We're not just focused on drugs and alcohol. We really want to give a message of making positive life choices because of the effects it can have on your overall life. As Beth referenced some numbers, I mean, a lot of great people put a lot of time in. We didn't put a name to the Substance Free Coalition until 2015, but we really try to stress making positive life choices, and that encompasses many areas. And Beth did mention getting education early on. That's one of the goals of our committee, is trying to get to students before they're feeling pressured or life is really pushing them down and they turn to one of these alternates to try to cope. Beth did allude to a healing study in some our community. Unfortunately, the money that we have appropriated to the town, we can't put towards that mission of education and targeting young students at this time. I'm not trying to steer the conversation that way, but we have some money that we're using right now, but it is people that are actively struggling with addiction, and they're trying to reduce overdose fatalities.
Well, in dealing with mechanical equipment, preventive maintenance is how you avoid mechanical problems. And I have to say, in my own experience as a substitute teacher, fourth graders are not immune from being involved in it because they have older brothers and sisters that basically are enablers. So reaching down. So the earlier you start, I think the better off you are. And this, I'm just speaking from what I call empirical observation based upon direct experience.
Exactly.
And we do have, our coalition is so broad-based. I mean, as Beth alluded to, we have police, we have fire, we have teachers, we have retired superintendents, we have counselors like Beth. But the school, we have a representative from each of the schools that have been vital to access to the schools and their input. It's just a broad coalition that has come together. It's not a big coalition. We always want to expand. We're always looking for people to get involved, and we don't need you to have special skills. But we're very fortunate with the coalition members that we have, that it's such a broad background that if somebody doesn't have expertise in one area, somebody else does, and we're able to make things happen.
And I think what's also important to point out, these are a group of volunteers.
I have to say that if it wasn't for volunteers in the community, at least in my public service, you wouldn't get anything done, because it's the group of people who are interested enough to be involved are what drives a lot of things in the community. Do you have kids on representing the in any of these committees?
Well, as far as sitting in on meetings, we don't have, they're welcome.
They wouldn't go to meetings.
Yeah.
Okay.
No, but
I mean, I know kids.
Anybody is welcome if they want to make
Yeah.
a positive difference. But we definitely have an army of kids, as Beth alluded to, at Upper Cape Tech, at Bourne High School, at Bourne Middle School, that we can call on. So if we have an event that the Substance Free Coalition is sponsoring or active in, and we need people there, we have an army of kids that have been very loyal to us to help us out, and they show up at our events and they provide manpower.
Well, I also think that those kids can also provide you insight as to what,
Absolutely.
as to what what the present motivation and fads are, among their peers. And in a lot of programs over the years, I found that there's a great effort of doing something for rather than with. So the question, that I have for you, in this program, what are you doing with the people that you're working with to try to, let's say, to move them away from it? And I would ask you one other thing, many people, and I'm not promoting 12-step, or any other program, but many people have discovered that if they replace a bad addiction for a good one, it helps them let's say, move in a positive
Absolutely.
direction. And I'm wondering as to whether or not you're suggesting that, or you're or let's say, supporting that.
Well, I think I am a firm believer in everything in moderation, and that's what I work with my clients
Mhm.
with. Okay, so if you're doing something that's interfering with your daily responsibilities of living, that's a time when you might have to look at it.
Mhm.
But when you look at excessive behavior, well, exercise is a great way to do things that on a regular, consistent basis, that's very helpful for you.
Yeah.
Community service can be very, very rewarding to people. So I guess what it is, it's like, what's going to make someone's internal, heart tick? So it might be community service, it might be exercise, it might be sports. Sports are a great thing for kids and for adults because it gives you the community, it gives you the collaboration, it gives you the connectedness. As we all know, going through COVID, one of the biggest things, and hard for kids as well as adults, was our inability to connect, to have this. So anything in moderation and anything that's going to drive a student or an adult down a road that's positive and beneficial to them.
It always disturbed me when the town meetings would talk about cutting the school budget and eliminating sports, because I see kids with an enormous amount of energy. When you're raising kids, as we all have, that energy has to go someplace, and sports are a way. Unfortunately, not everybody qualifies, to be varsity or even JV. So the idea of exercise is something that I think we ought to encourage all the kids to do, and also what I'd call some of the older adults, because they discovered that one of the ways you can put off Alzheimer's is indeed to physically
Absolutely.
exercise, as opposed to doing the crossword puzzle, in the morning, but just to get out there and go for that walk and just get off the video game,
Exactly.
get off the bench, and just go for a walk, which will
We'll feel you.
keep you, as the Jesuits used to say to us all the time, a sound mind needs a sound body to support it.
Well, I think, and that's what research is also showing, is the importance of mindfulness. Yoga, balance, Tai Chi, all of those to calm the mind down, to get more centered. And I think when you look at wellness centers and different activities, the power of mindfulness is getting more recognized as a healthy way.
I've heard that term mindfulness quite a bit, and I wonder if you'd give the folks some idea of what the definition of that is.
Mindfulness is really, in my opinion, getting more centered, in being more aware of your surroundings, listening to yourself, quiet. Just, think about it. Think in our lives. We're busy, busy, busy. We're running here, we're running there. Just to take that time and center. Mindful eating, for example. Think about it. How many times has somebody gone, you had to grab lunch, and you're eating a sandwich, and you're driving down? No, to sit down and mindfully eat. Mindfully be with somebody. So as I'm sitting here with you today, my focus is with you, okay? Not here and my head going in 1,000 other places. So the ability to focus.
Remember back in the 70s, there was a book called Zen and the Art of Motorcycle Maintenance? I think that's one of the points that they made. It was neither about motorcycle maintenance, nor was it about Zen. It was just about being involved, being where you are, being present in your moment.
That's correct.
Yeah.
And that's the best way that I can describe it.
So Joe, what is the, Jim Cummings was telling me that they have a drug that they use to, let's say, to forestall, let's say, desire for abusive drugs.
Vivitrol, right?
Excuse me?
Vivitrol.
That Jim Cummings uses?
Yeah,
Yes, it's called Vivitrol.
Vivitrol, yeah.
Yeah, and I think it's a great program that he utilizes with his inmates, and I can't say enough about it. I think it's a great program. one of the things that when working with kids that have come out, been released, is making sure that they get that next appointment in 28 days. And I saw that as a little bit of a struggle when it first came out, but what I have heard, and I think this is a great thing, is they have navigators, they have people that are following up and making sure that these people are getting to their appointments. So I think it's a great thing.
Yeah, we've heard good things about that program. As far as our committee, that's not something we're directly involved in. A lot of our outreach is going to be educational. The type of presentations. We'll do community presentations. Hidden in plain sight is something you may have heard about. And we set up a mock bedroom. It looks like a teenage child's bedroom. And only adults are able to walk through it, parents or adults, no kids. And it shows where people may be hiding drugs or alcohol. It's amazing the things that you can buy on the internet now. Simple water bottles that break apart, that there's a spot to hide things behind a label. That's just one example. Soda cans that look like soda cans, but they really store other bad chemicals for us to ingest. Hidden in plain sight has really been a big hit. That's something that whenever it's pre-pandemic and hopefully post-pandemic, we try to provide those. If a church asks us to host a hidden in plain sight, a group of committee members will set that up for a night. We've done it in the schools. We try to bring in speakers into the schools. I did allude to earlier that we're always looking for people to get involved with our committee. Unfortunately, all these things we do, like speakers that we bring in, like Beth alluded to, Chris Herron, it costs money. So we always need money, and we always need people.
Don't be afraid to ask for it.
Well, that's what I'm hoping right here. We've been very fortunate.
And if they wanted to give you some money, how would they get it to you?
Contact.
Yeah, we can give the contact or the Bourne Substance Free Coalition. We have a Facebook page. We do have a website that is under construction. But like St. Peter's Church is very generous. They always are donating to our causes. But one thing that I mentioned earlier, this Mass Heals, or this healing community study, the federal government has really realized that we have a crisis in our country with overdoses and addiction. And they've put some money behind it. And I think, Beth, correct me if I'm wrong, it's $800 million nationally. In tune, that's, if I remember right, it's $84 million for Massachusetts. And what they did is they picked 16 communities to focus on. 2 of the communities happen to be Bourne and Sandwich. So they looked at the numbers that Bourne and Sandwich had for overdoses in previous years, and they're targeting a reduction in overdoses for Bourne and Sandwich, along with these other 14 communities in Massachusetts, by 40% by June of 2022. So some of the programs that residents in Bourne, I'll speak to Bourne, that they're going to start seeing it currently in place and over the next roughly year and 1 month is there's going to, we'll talk about the bags in a second, but there's going to be a mobile van that goes around Bourne 2 days a week. I think it's Tuesdays and Fridays. It's going to have certain locations that it goes, and if somebody is struggling or needs Narcan or needs to talk to a counselor, they're going to be staffing this van. And that grant's helped to pay for that. So it's an outreach that it's going to be around our community, and people can go up to that van if they need Narcan, if they need resources. They're also funding Narcan at the fire department. So if we go out to an overdose call, and we transport a patient, and even if the patient refuses to go to the hospital, we can now leave Narcan in the home of that person. So if they're struggling and they have an overdose down the road, the study is paying for that. It's called Leave Behind Narcan. But one of the biggest things we have that we're excited about, because we really think this is something we talked about for a while, but we did not have funding, is the creation of a Bourne resource bag. And what this bag has is it has toiletries, toothbrushes, toothpaste, it has winter gloves, it has socks, it has face masks, it has hand sanitizer. But probably the most important we think is it has 2 doses of Narcan. And we were very fortunate. We partnered with the 4 area hospitals, Toby Hospital, Beth Israel in Plymouth, Falmouth Hospital, and Cape Cod. So if a patient goes to any one of these hospitals and they have had an addiction or an overdose, when they're discharged from the hospital, they're given one of these bags free of charge. Now, each bag, to put that together, is about $60. The Narcan cost $40. There's a cost for the other items in the bag. But because of this healing studies, we're going to have the possibility of making 300 of these bags.
Mm-hmm.
In addition to the hospitals giving them out, anytime there's an overdose in the town of Bourne, within 3 days, this van, along with the Bourne police, are going to do follow-ups.
Mm-hmm.
And if the person does not have one of these bags already when they were discharged from the hospital, the van is able to give them one of these bags. So every overdose call in the town of Bourne, within 3 days, should have access to one of these bags.
Do you have any pushback from parents because of stigma?
Well, I'll do a couple of things. The Knockin is definitely a critical piece in this bag.
Okay.
Okay. First of all, if I can just, this bag, it's collaboration. It shows Bourne Fire, it shows Bourne Police,
Mhm.
it shows the Substance Free Coalition, and it shows the National Institute Healings Initiative.
Okay.
But it says that our community cares about you.
Okay.
Okay? But what's in it too is resources. So resources for families, resources for individuals who might want to seek help.
Okay.
So it will be Gosnold, it will be the Barnstable Substance Abuse Directory.
Okay.
Just great information. Gosnold's in here.
On how to get help.
Right,
Yeah.
Coping Today, how to recognize an overdose.
Okay, so there's good resource
There's-
information in printing.
Absolutely.
And I think this is one of the things that, people who get to the point where they take responsibility for what's going on with them would be looking for that, so you're giving them that opportunity.
Exactly. So like this is the Cape Cod Substance Use Resource Guide, which is just full of information. And it's helpful because like we had just talked before about, when people are ready, they're ready. Well, if we take them, we've given them the water, it's up to them to drink it when they're ready.
And I think that's one of the
me.
important takeaways for anybody that's watching this program is that regardless of how you might feel about the importance of something, until the person that is affected by this accepts the responsibility for it and takes that first step on their own, nothing will happen. We're almost at the end of this, and so the question I would have for you, what is the main takeaway that you would want people to have from watching this program?
What you just think? I think we have a great committee. We always want to expand. Any ideas are welcome.
Mhm.
So we really, the more people that get involved, the more good we can do in the community.
Well, I would agree with that for sure because everybody has a level of expertise. And so I'm a firm believer that 10 heads work better than one. So the more people that can join us and help us, the more work we can do. Many hands make light work.
That's exactly right, and I think that's a good place to end this program. So with that, I want to thank the people for watching us. I think you've learned a lot about the nuts and bolts of getting help, and I hope those who might need it will take advantage of it. And I want to thank the viewers again for watching another edition of Bill's Bullpen, a production of Bourne TV.